Dr. Scott, are there psychological side effects to long-term antidepressant use, like becoming indifferent or apathetic because you can't feel your feelings as much?
Yes, there really are. And in fact, it's the psychological effects that have led to more knowledge about the drug studies that led to the approval of these drugs than anything else. We have what's called the Freedom of Information Act in America.
All right.
As a result of that Freedom of Information Act, whenever we have a lawsuit, we can go and get information that the drug companies do not want us to see. And so as a result of some killings where we had people taking these drugs who had no history of violence, all of a sudden start killing people that they didn't even know. We've had some just real tragedies. A number of these have happened. And it's led to lawsuits that have allowed us to look at the drug studies. It's revealed that, boy, there's a lot going on there that we didn't know about. Absolutely, these drugs can cause suicidal thoughts. For example, the drug companies knew this early on. They knew the agitation that is common with these drugs. They knew that before they were ever approved the first time. And yet, in fact, they try to mask that by giving the sedatives, the chloral hydrate, to those subjects taking these drugs so commonly. So consequently,
Which calms people down.
it calms people down.
Okay.
So yeah, and of course you still look when you open up the package insert that comes with Zoloft. You find, we know for example that those on Prozac after only 5 to 6 weeks, 10% report having shakiness like this.
Okay.
Zoloft the same kind of way, 11% after 8 weeks like this. And so we know that it's causing a real problem. The concern is what happens after a year or 2 years or 5 years on these drugs. What is happening to the brain? And of course we know there's brain shrinkage. We've done experimental research with rats. We can give rats these drugs, these SSRI drugs. We know that it leads to shrinkage. Just like we know that Parkinson's disease leads to shrinkage. Well, guess what Parkinson's does? It causes movement disorders. Guess what we know? That antipsychotics, now we know about antidepressants, the same thing, leads to movement disorders. It all fits together. It's all very reasonable. And yes, it causes what we call a blunting effect.
Blunting, all right.
Sometimes called a frontal lobe syndrome effect.
Okay.
Because
that's real.
Yeah, it's real. We have these frontal lobes here, and if you simply blunt them with alcohol, with an antidepressant, then you have that natural instinct not to kill yourself that's blunted. It's not that it ever gets you over depression, because there's no study that's ever found that, not when you do the right kind of study. That's a fair, honest, double-blind, placebo-controlled study. Never found. But we do know that it causes you to have that natural instinct to preserve your life blunted. And so I think people who have friends on antidepressants or antipsychotics, they've seen this. They've seen their friends with those blunted emotions. They're walking around not quite them.
Okay.
Their emotions are blunted. Sometimes I've had people tell me they felt like they wanted to cry, and yet they weren't able to cry. And so the emotions are blunted. Now, on the other side, we ought to mention one of the concerns we should all have, and I have an appendix in my book, America Fooled, that deals with this. Sometimes people withdrawing from drugs abruptly have very severe withdrawal syndromes. And consequently, we need to make sure that folks don't simply stop taking the antidepressants all at once cold turkey without being aware of what the danger is. They need to be watched over closely because reality is some of those folks think of suicide at that point.
Okay.
I've talked to lots of people, so I'm convinced it's probably not, but maybe 10%, maybe 20% who have that severe reaction. But because a lot of people do get off, a lot of people get off cold turkey and they don't report this at all. But I've talked to enough people who have had that reaction themselves that I know that it's real. There is a professor at Harvard Medical School who's written a book on how to get off the drug. And he basically, a whole book, he recommends just do it very, very slowly. Break off a little bit more each day until you're down. Wean yourself off the drugs and make sure others are aware of what you're doing because there is risk there.